know that 1 in 9 men will be diagnosed with prostate cancer during his lifetime? Now, September is Prostate Cancer Awareness Month, and this morning we are taking a deeper dive into a newly published study that sheds new light on the potential of immunotherapy in African American men who are at an increased risk of developing the disease. Dr. Oliver Sartor, he is the medical director at Tulane Cancer Center, and he is here to explain that to us. Thank you for joining us, doctor.
Glad to be here. My pleasure.
You know, I was reading the statistics for the interview, and it's unbelievable. 1 in 9 men will be diagnosed with prostate cancer in our lifetime. How do men get prostate cancer? Let's start there.
Gosh, well, I wish I really knew the answer. There are risk factors, and those risk factors are age. The older you are, the more likely it is that you can have prostate cancer. It's very rare under the age of 40. Increases at age 50, yet again at 60, yet again at 70. So age is very important. Family history is very important. Your father or brother had prostate cancer, that's a risk factor. Or if your mother or sister had the breast cancer, that is also a risk factor for prostate cancer. And then race. African American men are more likely to get prostate cancer, very substantially, 74% higher than our non-Hispanic white men. So age, race, and family history are the big three risk factors.
And how many men a year? About 191,000 a year?
That is correct. 191,000 men a year in the United States, most common cancer in American men. And as you probably are aware, it's the second leading cause of cancer death in American men. So it's something you do have to take seriously.
Unbelievable. Well, luckily, there are some things coming out, including the use of immunotherapy in prostate cancer. I know Dendreon has the FDA approval for one of the types of immunotherapy. Can you tell us a little bit more about that? And what does it do for people with prostate cancer?
Yeah, it's very interesting. So Dendreon is a company that's had an FDA approval since 2010, and it actually is a vaccine. It's kind of confusing to people because most of the time when you hear a vaccine, you think, oh, it's going to prevent it. But in this case, the vaccine actually seems to slow the progression and prolong survival. And the way you do it is you take out some cells from the individual patient, and then you immunize those cells in a test tube against a protein called the prostatic acid phosphatase, and you juice it up a little bit with some immunostimulants, and then you give those cells back to the patient, and those cells help to stimulate the immune system to go fight prostate cancer. And the result is, after these therapies, you prolong survival for those men who receive it. So a very interesting immunotherapy, one of the first immunotherapies in solid tumors to really work.
It's interesting. So, is it that you get it before you have prostate cancer as a preventative, or is it for people who already have the prostate cancer and they're trying to, bring it down a little bit, if
Yeah,
that's the word?
it's for men who already have prostate cancer. It'd be lovely to have some type of preventive agent, but we don't really have that. This is for men who have prostate cancer that has progressed despite hormonal therapy and has evidence of spread. And so that's the particular population where the FDA approval is. Already have the cancer and have progression despite hormonal therapy and have evidence to spread.
And there's a study that actually just recently came out talking about how immunotherapy can help benefit African American men who have prostate cancer. Tell me a little bit more about that.
Well, it's a very interesting study, which I was quite intimately involved. And it started some years ago, and over 2,000 men were treated with this agent, and we tracked all of them. It's called a registry. It was not a clinical trial, it was a registry. And what we found out is that the African American men who received this particular prostate cancer vaccine, this immunotherapy, lived substantially longer than Caucasian men. And that was quite a surprise. We'd had a little preliminary data that perhaps this would be true, but we were surprised to the extent of the finding. African American men do better with this particular immunotherapy if they have prostate cancer. And that's good news for patients.
That is definitely some good news. Doctor, thank you so much for joining us this morning, because I think it's important that especially the men watching, as well as the women with husbands, brothers, cousins, nieces, nephews, just really, that they know about this. Because even though it's very uncommon for men to get prostate cancer under the age of 40, one of the biggest things is to get your prostates checked at 50, right?
That's correct. And if you have a family history, perhaps even earlier. So we do recommend a PSA blood test. We do recommend a prostate check, all men starting at age 50. But for those at even higher risk, particularly those that are brothers and fathers with prostate cancer, even starting a little bit earlier.
Come on, gentlemen, we can do this. Let's get those prostates checked. Thank you, doctor, for joining us this morning. I learned so much, and if you want to learn more about doctor's practice, you can go ahead and log on to medicine.tulane.edu/centers institutes /Tulane-cancer-center. You're seeing it right there on your screen, or give them a call at 504-988-7869.